Survey has revealed that a shockingly high number of young New Zealanders have contemplated self-harm or suicide in the past year.
The international survey found 40% of Kiwis aged 18 to 34 had considered harming themselves.
It comes as more mental health beds face closure.
From bad to worse, there were 0 new acute mental health beds added under Labour.
It's taking way longer than it should do, but there is progress now evident.
And now, in Christchurch, all 15 beds at Hillmorton Hospital's Tupuna inpatient mental health unit face the chop. Te Whatu Ora blames staffing issues. The opposition says the possible closure's unacceptable.
We find out that we don't have one extra mental health bed, but on top of that, now we find out that in Christchurch, we're at risk of losing beds as a mental health inpatient facility closes down.
The Mental Health Foundation says the bed issue points to systemic problems.
I think it is a good example of lack of progress, but it is certainly not all about beds.
That's because the issue runs much deeper. With the new international survey, the Foundation says is a wake-up call for all politicians. Research company Ipsos finding over the last year, 73% of Kiwi 18 to 34-year-olds were so stressed they couldn't cope. 51% felt so stressed they couldn't work. 40% felt suicidal or considered self-harm.
We need to approach mental health with the same urgency as COVID-19. It's a crisis.
The Health Minister insists he's working on it.
We've made a concerted effort since the time we've been in government to stop the neglect of mental health and to beef up our frontline services.
That shows no signs of letting up in Aotearoa.
A new report out by the government basically showing that our GP practices, particularly our high need ones, require a 231% increase in funding to even be viable. Biggest thing we are missing in this country when it comes to mental health is an actual comprehensive plan, one we can follow all the way through.